What is orthopedic surgery? Well, orthopedic surgery is a branch of medicine. Surgeons treat disorders of bones, ligaments, muscles, and tendons. Surgeons do checkups, they perform surgery, help you get back on track, and help you feel all better. Are there any risks when you become a surgeon? What risks are there? Well, there are plenty of risks when it comes to becoming a surgeon. Every day, surgeons go into the operating room helping patients and treating them, but while doing that, there are some risks that come with it. They are exposed to people who could be very sick, and they put their life in danger just to help their patient. Orthopedic surgeons need to be aware of the hazards and not take it as a joke. Orthopedic surgeons have a huge risk because they use saws, drills, and sharp bone fragments. They could cut themselves with these tools. They encounter a lot of viruses like hepatitis B or hepatitis C. These risks are very dangerous and can get doctors sick. How do orthopedic surgeons choose their specialties, and what are the different specialties? People at the beginning of medical school want to do a certain specialty. Sometimes they change their mind. Medical students usually have a general area about what they want to do. In the first 2 years of medical school, you learn about science. In the other 2 years, you go into specialty training. Medical students go to different hospitals. Whether you choose to be a generalist or a specialist, you have to have very advanced training. Orthopedic surgeons are well known for treating sport injuries, including muscle strains, ligaments, and other things. This type of highly trained orthopedic surgeons treat many different types of conditions that include infant to seniors. Not all orthopedic surgeons just do surgery. They will first find medication, injuries, and rehab. Before going straight to surgery, surgeons often reach out to other medical care places and doctors. They reach out to doctors like neurologists, therapists, and physicians. How has surgery changed over the years? Many developments in orthopedic surgery have come from war fields. When someone on the war field would get injured, they would get treated with a bandage soaked in horse blood, which would make a splint. The advances in orthopedic surgery had made some of the things people thought were untreatable actually treatable. Anesthesia was only used in the mid-1800s and onward. Now we have a lot of technology. Orthopedic surgeons now use something called computer navigation. What it does is it is like a little camera. You put it in the body part and it guides you while you are operating. It has helped surgeons a lot. In general, technology really helped improve orthopedic surgery. According to Ajit, the person I interviewed, the tools and techniques have changed a lot. How have they changed? The tools have changed because they've gotten more accurate and more precise. The techniques are less invasive and they help patients recover faster. Do orthopedic surgeons have stress? If so, why? Doctors usually get burnouts due to being in a state of exhaustion. What is a burnout? According to the article, a burnout has 3 different components: emotional exhaustion, depersonalization, and a loss of personal accomplishment. There is a 40% rate of burnouts in the medical field. There is a 13.3% rate of suicide among all the surgeons. The burnout rate in residents is 30% to 40%. Surgeons work long hours every day. Surgeons deal with life and death situations on a regular basis. Surgeons have depression, anxiety, and they can also get divorced or broken relationships because of their job. According to the site, there was a study of 582 surgeons at University of Michigan, Ann Arbor. They showed a 32% of high-level emotional exhaustion. There was also a 13% of depersonalization and 4% of a low sense of personal accomplishment. What do orthopedic surgeons do on a daily basis? On office days, they do checkups with their patients. They study their notes and fill them out after doing their checkups with their patients. When a patient schedules a surgery, before the surgery, physicians talk to their patients. The surgeon talks about the procedure and what is going to happen during the surgery. Some surgeries only take 30 to 40 minutes, leaving the surgeons with more time to treat other patients. Some surgeries take longer, leaving surgeons with only 1 or 2 surgeries that day. The process of Capstone wasn't hard, but it definitely wasn't easy. It was hard to get all my sources at first. I wanted to give up or change my topic, but I wasn't going to do that because I love this topic and don't want to switch it. I kept the topic. I switched my sub-questions a lot and made sure that they made sense and I could get sources on them. The interview wasn't hard because I knew someone who was an orthopedic surgeon, so it was easy for me to find an interview. Another hard thing was the blog posts. They weren't hard, but I had to write them thoroughly. This project was definitely a cool experience. There were a lot of struggles, but I learned a lot from those struggles. Along the way, there were definitely problems, and I fixed them. I also made mistakes and learned a lot from this project. What I learned from this project is that you definitely have to be patient with your interview and finding your resources. It was hard to find the resources that specifically answered my questions. I had to be patient and keep searching. Overall, this project was a fun and great learning experience.